Welcome to the Nevis Newscast for Thursday, November 14th, 2019. I am Fredicia Liburd. The Honorable Hazel Brandy Williams, Junior Minister of Gender Affairs, is presently in Kenya attending the Nairobi Summit on the International Conference on Population and Development ICPD 25 under the theme Accelerating the Promise. The summit, which runs from Tuesday 12th to Thursday 14th November, is sponsored by the governments of the Republic of Kenya and the Kingdom of Denmark, together with the UN Population Fund. It brings together delegates from 179 member states of the UN, parliamentarians, local governments and authorities, international financial institutions, intergovernmental community-led and civil society organizations, networks of young people, women's groups, private sector partners, and academia. Minister Brandy Williams will participate in the Women Parliamentary Forum at the high-level dialogue captioned When Women Lead. She will co-chair the session, which focuses on the current ideological framing and political context around women's rights and gender equality, with a focus on leveraging the leadership of women to counter the narrative and uphold human rights and sexual and reproductive rights. This high-level caucus will bring together senior women leaders, inclusive of first ladies, ministers, heads of agencies, and multilateral institutions, parliamentarians, leaders in research and academies, business and private sector, young women leaders, and media personalities. The dialogue will focus on the role and impact of women leaders at various levels and across sectors, and how the leadership of women can be leveraged in a transformative way towards accelerating implementation efforts to fulfill the goals of the ICPD agenda. Minister Brandy Williams will return to the Federation this weekend. Today, Thursday, November 14th, the Ministry of Health brought together diabetic and hypertensive patients and members of their families for a diabetics symposium on the occasion of World Diabetes Day. Also participating in the forum were doctors, nurses, representatives of the mental health unit, the health promotion unit, as well as community nursing services. The theme was family and diabetes.
We are raising awareness of the impact that diabetes has on the family and support network of those affected, and promoting the role of the family in the management, care, prevention, and education of diabetes. Families are urged to learn more about the warning signs of diabetes. Left untreated or unmanaged, diabetes can lead to life-changing complications. These include blindness, amputation, kidney failure, heart attack, and stroke. Early diagnosis and treatment are key to prevent the complications of diabetes and achieve healthy outcomes.
Coordinator of Community Health Services, Nurse Ermin Jeffers, who chaired the symposium's opening ceremony, noted that all families are potentially affected by diabetes.
Family support in diabetes care has been shown to have substantial effect in improving health outcomes for persons with diabetes. It's therefore important that ongoing diabetes self-management education and support be accessible to all persons with diabetes and their families to reduce the emotional impact of the disease that can result in a negative quality of life.
The feature of the Diabetics Symposium was a presentation by Dr. Flora Hobson on the theme Family and Diabetes. The diabetic and hypertensive patients who rendered the diabetic song and recited the diabetic pledge were also given a quiz to test their knowledge of diabetes. The symposium also featured remarks by Shalissa Martin Clark, Acting Permanent Secretary in the Ministry of Health, and Dr. Retner Walwyn Brown, Deputy Medical Officer of Health. Meantime, the Ministry of Health is offering a number of health care options for persons living with diabetes. This is according to Junior Minister of Health, the Honorable Hazel Brandy Williams.
Screening for complications of diabetes is also available through the Chronic Disease Program offered at our clinics. Persons affected with diabetes receive foot care, eye examinations, EKG testing, and routine lab tests checking for any early signs of nerve, blood vessel, kidney, and heart damage. Additionally, medication and testing strips are readily available free of cost or at a reduced price to persons with diabetes, thereby eliminating the financial barrier that can prevent persons from accessing the medicine that they need.
The Health Minister made these comments during an address to mark the observance of World Diabetes Day today, Thursday, November 14th, 2019. Minister Brandy Williams says the ministry is also offering support groups.
The Ministry of Health recognizes that having diabetes can be challenging as it requires strict dietary, weight, and medical control. For some persons, it requires a complete change in lifestyle. To address this aspect of self-care and management, this year, persons are offered the opportunity to participate in a chronic disease self-management program which imparted knowledge and skills on healthy living. This type of program, coupled with support groups such as a Diabetes Association, will augur positive outcomes as opportunities for encouragement and knowledge sharing about best practices for the development of healthy habits can help an individual in the control of his or her diabetes.
The theme for World Diabetes Day is family and diabetes. Still to come, 3 bills to come before the November sitting of the Nevis Island Assembly. The details after this break.
Welcome to Nevis.
It's easy to believe that all Caribbean islands are the same until you visit Nevis.
Nevis is the Caribbean of a bygone era.
You will enjoy a most intimate vacation on Nevis. You're only a stranger here once.
We offer exclusive and barefoot luxury stays.
With only 400 hotel rooms, our island may be exclusive.
But the warm, genuine and friendly welcome is just everywhere.
We look forward to meeting you.
Visit nevisisland.com.
Welcome back. 2 bills will be introduced and have their first reading, while 3 bills will have their second and third readings when the Nevis Island Assembly convenes in chambers at Hamilton House from 10 a.m. on Tuesday, November 19th, 2019. The announcement was made via the order paper dated November 13th, 2019 from Clerk of the Assembly, Myra Williams. Premier of Nevis and Minister of Finance, the Honorable Mark Brantley, will seek leave to introduce and have read a first time the Nevis Business Corporation Amendment Bill 2019 and the Nevis Limited Liability Company Amendment Bill 2019. During the sitting, the Finance Minister will also move the second and third reading of the Integrity in Public Life Amendment Bill 2019, the Nevis Business Corporation Amendment Bill 2019, and the Nevis Limited Liability Company Amendment Bill 2019. The Integrity in Public Life Amendment Bill 2019 was introduced by Minister Brantley and had its first reading when the Assembly met on October 8, 2019. The sitting will commence with the formal entry of President of the Assembly, Honorable Farrell Smithen, followed by prayers, a motion for the approval of the order paper as circulated, messages from the Deputy Governor General of Nevis, Her Honor Hailita Liburd, announcements by the President, papers to be laid, statements by ministers, personal explanations, the introduction of bills and first reading, public business where the bills will have their second and third readings, followed by the adjournment. The Early Childhood Development Unit and the Ministry of Education hosted a debriefing on the Early Childhood Regulatory Framework on Wednesday, November 13th at the Nevis Disaster Management Department.
This debriefing is comprised of 4 distinct areas. And what you will see here before you is we will talk about policy development, we will talk about minimum standards, we'll also address the legislative and policy reform and the action planning that is necessary within early childhood education. I want to make clear at this juncture that this is a debriefing, so we will not be going into details about the early childhood policy that has already been developed and extensively consulted on. What we will talk about is a process that informed the policy development.
Assistant Secretary in the Ministry of Education on St. Kitts, Dr. Tricia Esdale, outlined the focus of the debriefing.
The focus of the presentation this morning and the debriefing is actually on the last 2 points, which is the legislative and policy reform and the action planning. One of the things that would have been readily evident is that in developing the policy and in developing the minimum standards is that there's a lot of work to be done in early childhood. And that work requires that we take a good look at the acts, the regulations, and the laws that govern the sector. And in some instances, the recommendations that are embedded in the policy and the standards of best practice with respect to the minimum standards require that there is some revision or review of the existing regulatory framework for early childhood. The last part of our presentation will look at action planning. And the action planning is really just to frame the work and the direction in which we're going for you. As I would have mentioned, because there is a certain amount of reform that is required, we want you as an audience to understand where we're going in early childhood and what the next steps are.
A number of early childhood professionals on Nevis and St. Kitts participated in the meeting. That's it for this edition of the Nevis Newscast. On behalf of all of us here at the Department of Information, I'm Freddie Liburd. Thank you for viewing.